Well, welcome everyone. Today's program, as previously mentioned, was going to be talking about a new, well, it's not really new, it's been around for a while, but it's had a different title. It's now Infection Prevention and Control and Antibiotic Stewardship Program. And these are the conditions of participation from the Centers for Medicare and Medicaid, also known as CMS. And as some of you already know, if you participate in Medicare and Medicaid, you have an agreement with them, then you must meet all of the requirements regardless of what kind of patient you take care of. I also want to point out you can reach out directly to CMS and ask their question. If you do have a question, you get their response back. Keep it with your documents so you can show what you did was in response to their direction. Well, let's go ahead and get started. As I mentioned, we're here today to talk about the conditions of participation. Any hospital that accepts Medicare, Medicaid funding must oblige and follow all of those conditions, no matter which patient they're taking care of. How do you keep up with changes? Because CMS likes to do some changes. Well, first you want to make sure you have the most current manual. If there is a new manual, check that transmittal page. Look for the survey certification website, because that's where CMS posts their memos to their surveyors and to the public on what's changed. The manual, the parts we're talking about, overall though, the manual first came out in 1986. Multiple updates. The last one was in February of 2020. We're coming up on almost 2 years. As of today, in fact, it's 2 years. On what the actual changes were, it started back in 2019. It's called the Improvement in Patient Care Rule. Short term is Hospital Improvement Rule. It went into effect in November. Interpretive guidelines and survey procedures are still pending. Now, again, the manual came out in 2020, but what happened is these changes came around, they were approved, but didn't get into the manual in time. I'm going to start off by talking about Joint Commission and their antibiotic stewardship program, because they did multiple amendments also at the same time CMS did. Well, before we really get into it, I also want to talk about some memos CMS put out. Remember I told you about the memos where these are the rules, this is what's changed, what's new. CMS did put out several memos related to infection control, starting with insulin pens. And by the way, on ISMP, for 2021, this remains one of their top 10. Insulin pens. The idea was it's only on one patient. That's it. Nobody else. Well, CMS found some healthcare providers weren't aware of that. It's like using it on more than one. It's like sharing a needle. So every patient must have their own pen marked with their name. Well, moving over to CDC, some of the update, when they're talking about cleaning, disinfecting, specifically reusable medical devices, because we were having quite a problem with our reusable devices not being cleaned and transmitting infection. This one happened here in Colorado. Patients developed infections, and 3 of them unfortunately suffered fatal consequences because they had a medical device that caused these infections to be transmitted. It was a duodenoscope. And there was a very tiny part into it, courtesy of Johns Hopkins, and it shows just how dirty our hands are and what can be included on those. Safe injection practices, sharp safety. That's the next section with the worksheet. What they're going to do is they're going to look at 2 separate patient care areas. They're looking at injections and sharps. How are they managing them? Are both units consistent with what your policy and procedures say they are? Are injections prepared using aseptic technique? Are there 1 needle, 1 syringe per patient? And that includes insulin pens. Are injections prepared using aseptic technique? In other words, the area is clean, no blood, no bodily fluids around. It's a clean area. So they're going to ask, are you wearing appropriate protection, gloves, gowns, eye mask, whatever it is, so that the provider, the person who's doing that, isn't exposed to agents or chemicals? Are objects that are touched frequently, are they cleaned daily with a registered disinfectant? Call lights, stethoscopes. There are standard precautions for CDC that include and cover what all of those are. High touch areas, do they clean those frequently? Bed rails, call button, even a light switch. Are those surfaces cleaned thoroughly for terminal cleaning if the patient goes home? In short, all of those linen, the towels, the bed linens, blankets, they all come out of there. Pillow covers, they come off. And are they properly cleaned? Disposable wipes, are they using those according to what the manufacturer says? Are cleaning cloths, are there clean cloths for each room? Are mop heads and the cloths laundered daily? As far as spills, are they decontaminated? to what needs to be done. Is there a cleaning schedule for even your equipment? Doesn't matter if it's a scrub sink, a refrigerator, or an eye wash station. Hand hygiene before and after. Only, of course, properly trained staff who have competency can insert it. Using maximal barrier precautions. That can be cap glove, full sterile drape. Chlorhexidine with alcohol prep to skin, unless contraindicated. Using that semi-permeable transparent gauze to cover it so you can keep an eye on the site. We did it so that if the site started to get red or ooze or something that just didn't look right, we could see it immediately. Of course, documentation of the insertion and why it's needed. Hand hygiene before and after you even manipulate the catheter. Droplet transmission. You want to use your NIOSH-approved particulate, your N95s. For those patients who do have to have particular suctions and irrigations, put them in the airborne infection isolation rooms. That's where they need to be. Providers also use that NIOSH-approved respirator. Have signs clear and visible. Do hand hygiene before entering and leaving, and limit their movement. Put a mask on the patient too, by the way, when you have your airborne isolation precautions. Your surgical tracers, they're done in a manner so that we can reduce infections. Staff do a scrub before they put on their gloves, and hands and arms are dried with a sterile towel after the surgical scrub. Then you put on the gown. The attire, the surgical attire, caps and hood, facial, head hair is covered. AORN, they have guidelines on that, when and what types of covering is to be utilized. Masked by all personnel in the restricted area, especially where there are open sterile supplies or scrub people are located. And tie the mask. Clean mask with every procedure. Now, you've probably been in your hospital where the charge nurse, maybe even a float nurse, whatever, within 2 surgical suites, they just walk in the room and they have the mask over their hand. It's not tied, and it's probably the same mask they've used in 3 other rooms. You might want to look at that. That could be a breach of the infection control. That simple thing of not putting on a clean mask and tying it appropriately. Well, I'm going to go ahead and wrap up here with some COVID-19 issues and what came out. Of course, multiple memos that talk about infection control on COVID-19. They put out several, what's called 1135 waivers. And this is to help you, the hospital and facilities, really concentrate on patient care and also infection control. There were waivers for long-term care facilities so that they could transfer patients who did have COVID to other facilities where there was an outbreak. In other words, cohabitate, cohort patients who were already positive. There were certain waivers. Some of them were blanket waivers. In other words, you didn't ask. You didn't have to apply to get the waiver. They just went across the board. There were prescriptive requirements on placement of an alcohol-based hand rub. They got rid of them because they thought the more we have, the better. Now, there were access restrictions so that there could prevent ingestion. New hire staff, they have to be trained on how to do their role so that we can prevent transmission. Mask, gown, gloves. Taking care of patients who do have COVID. What can you do? What should you not be doing? Monitor the website, by the way, for any current information and resources. Now, this is February of 2022. Things are slowing down. And in fact, in my state, as of this week, encourage this hand hygiene, respiratory hygiene. You know, you can walk into a Target department store now, and they'll have clean masks hanging up there for people coming in who don't have one. No-touch receptacles, hand hygiene supplies, those alcohol-based hand rubs. So thank you, everyone, for attending, and stay well.